Welcome to Health Talk. I'm Dr. Manny. We heard the shocking statistics about the misuse of opioids in this country, but there are other drugs you might be taking regularly that have very serious implications. Plus, you may not need them at all. To dig into this is Dr. Andrew Weil. He's here. He's a renowned expert in integrative medicine and author of Mind Over Meds. Know when drugs are necessary, when alternatives are better, and when to let your body heal on its own. Welcome, sir.
Thank you.
Always an honor. And a fantastic book, by the way. Everybody has to get this book. It's, he keeps writing better books every time. But let's be clear. You as an MD do believe that there are some, let's say prescription drugs that are valuable.
Absolutely. Some drugs are life-saving. Medication is a valid way to treat disease, but it's only one way. There are other ways of managing, especially chronic disease, and my feeling is that medication should never be the standalone treatment long-term.
Right. We tend to take a lot of drugs. We tend to take a lot of medications. Let's talk about the overuse of antibiotics.
Well, I think the public is aware that this is a real problem today, and it's an object lesson here because these are terrific drugs, and we've totally squandered their power by misusing them, by using them for trivial conditions, for conditions for which they're not indicated, like viral infections. Every time an antibiotic is given to someone with a viral upper respiratory infection, not only is the antibiotic useless, but that person's body becomes a factory for turning out resistant organisms.
Right.
We've used these drugs tremendously in the animals that we raise for food, in agriculture, growing of plants, and this has all driven the evolution of bacteria in very bad directions. We may well not have antibiotics in the future.
Let's talk about some natural, you mentioned that there are alternatives to the not using antibiotics, let's say for viral infections and things of these sorts. What kind of ideas can you give me in regards to?
Well, first of all, there are methods that were in use before we had antibiotics.
Right.
There are methods of disinfection. For example, compounds like silver, which is a very effective germicide.
I just hacked my head the other day, see, and I was panicking, and my wife says, no, I have some silver ointment.
So very interesting. So that's an example of
and it healed perfectly.
Right. There also are natural products that increase immune resistance.
Right.
Things like the Chinese herb astragalus, Asian mushrooms. These are non-toxic, and many doctors are not trained in using them.
Yeah. And I think that it should be part of medical school education.
Absolutely.
It should be definitely part of medical school education. There's an age group category that I get very concerned about is people over the age of 65.
If I look in the medicine cabinet of elderly people, I often see a dozen or more different prescribed drugs, often prescribed by different physicians. Probably those doctors had no communication with each other. We know that if a person is on 5 or more medications, the chances of an adverse interaction between 2 different drugs is very great.
Right.
This is a real concern. I think old people are on too many medications.
And plus their physiology changes.
They become more sensitive.
Their kidney filtration rate is not the same.
Absolutely.
They're not metabolizing, and they can get toxic.
One thing that I advocate in here is to use pharmacists more as a resource.
Right.
Because pharmacists are really trained to be experts in drug use.
Right.
Doctors don't take advantage of them. Patients don't take advantage
of them. Right. So, in other words, if you want to have a frank conversation and a non-biased conversation about your medication or medication needs, the pharmacist is the person you want to go.
Pharmacists are trained to provide a service called a medication therapy management review.
Right.
Often this is done for free, or it's covered by Medicare, and they will go over all your medications, tell you which are necessary, which aren't, which may be interacting. They can't make changes.
Right.
Only a doctor can do that, but they can give you the information and give the doctor the information.
Right, and I think it's a valuable tool, and I think people should take advantage of it. So, and of course, we have your website,
drweil.com,
which has a ton of information.
Right, about these other methods of managing illness. And again, I'm not saying you shouldn't use medication. But
right,
it
I know.
should not be a standalone treatment over time because it can get you into trouble.
You've always been very fair and balanced when it comes to these things. And of course, the book, again, Mind Over Meds. This is a fantastic book, and everybody should be reading it because it gives you valuable information how to get off some of these pills that we may not need. Thank you so much for joining us. Thank you, sir.
Good to talk to you.
Good to talk to you. And if you have any health questions, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.